and I'll tell you what you better memorize, what formulas. Okay, the first thing you have to know is that, how do I say this to make it go in order? Go back, the chapters are 19 through 21, right? So let's talk about blood plasma. First thing you have to know is what's in blood. Formed elements and plasma. Okay, then you have to know what are the formed elements. White blood cells, red blood cells, and platelets. Then you have to know what's in plasma. Well, the most abundant thing in plasma is water. But there's a major protein. What is it? Albumin. You have to know albumin is a major protein in plasma. Okay? Make sure you read the chapter about pernicious anemia. Maybe I did lecture on it. Did I say anything about it in lecture? You need vitamin B12 for normal red blood cell production. And you could have plenty of vitamin B12 in your diet and still be B12 deficient because you need to have intrinsic factor from your stomach. This is why they give B12 shots. How come they don't give you a B12 pill if you have pernicious anemia? Because pernicious anemia is a lack of intrinsic factor, not necessarily the lack of B12 in your diet. You could take a B12 pill, you won't absorb it because you don't have intrinsic factor. Well, not having intrinsic factor is a genetic disease. So I really can't, unless I fix your genes, it's kind of hard to. Pernicious anemia and intrinsic factor is on this test. And I just looked at it, I was shocked because I didn't think the renin, angiotensin, aldosterone system is on this test. Remember the whole blood pressure story where kidneys detect low? You guys want me to do it on the board? Okay. I would master this, and I would master this for several reasons. First of all, the nurses talk about it. That's just first of all. I have several students come back. Here's the two things the nurses students come back and tell me. They rush in, they say, Kiggins, tell me that renin story again. I have a quiz on it in 10 minutes. So I run through it for them. And they come back and they say, Kiggins, tell me the arterial blood gas pH story again. It's called the renin, angiotensin, aldosterone system. I'll spell that out for you. Into my kidney, renal artery. Inside my kidney, I have these little functional units called nephrons. You don't have to worry about that yet. But I have this special spot in my kidney called the juxtaglomerular apparatus. I don't even think you have to know that. I'm pretty sure you don't have to know that. But the bottom line is this. With low blood pressure, two things are secreted by my kidney. Low blood pressure leads to increase of erythropoietin and an increase in renin. Now let's do the renin first. What renin does is renin converts this pre-hormone called angiotensinogen into angiotensin 1. That's what renin does. And then angiotensin 1 encounters another enzyme in your body called ACE, which stands for angiotensin converting enzyme.